Hi, I'm okay. Wait, I'm sorry.
We're gonna restart. You
It's fine.
wanna?
We'll edit it. Okay.
Okay.
Hi, I'm Hannah Trolka, and I'm a peer leader at the health center, and I use she/her pronouns.
Hi, I'm Brianna. I use she, her pronouns, and I'm a sexual health peer educator through the Health Center.
Hey everyone, my name is Michael Golden. I use he, him pronouns. I was a sexual health peer educator last semester, and I graduated in December with a public health science degree and an LGBT studies minor, which is a thing, so check it out.
Awesome, and welcome to Queer Safe for Sex, everyone.
So before we get into the presentation, we just want to give a couple disclaimers, which really just involves the fact that when it comes to sex, we bring so many different things to the table, including our feelings, our values, our experiences. And what's really great about this being online is that if you're feeling uncomfortable or just feeling like you can't handle the information at this present time, you can pause it, come back and digest it all. And then just one more disclaimer that I'm going to read right from the slide. Anatomical terminology most widely used in medical and clinical spaces will be used for this presentation. We recognize that people use all sorts of different terms to describe and affirm their anatomical body parts, particularly their genitalia. We encourage people to explore and discover the language and terms that they feel comfortable using to describe and reference their genitals so that they can better communicate about them with their medical providers and potential partners. Finding ways to talk about them can help us keep them safer, healthier, and feeling good. And so I think the biggest takeaway from this slide is that during this presentation, we are in no way saying that anyone's genitals equals their gender or sex.
All right, thank you so much. So I'm just going to go a little bit over the presentation, what we're going to be talking about today. So first, we're just going to be talking about sexuality and sexual health. Then we'll discuss consent, STIs, safer sex, sex during a global pandemic, and campus resources.
So I'm just going to be briefly talking about what sexuality is, and sexuality is more than the act of just doing it. So it's more than just intercourse or sex. There's a whole bunch of expansive lists of what sexuality can be, especially for individuals or groups of people, specifically the LGBTQ plus community. Our definitions of sexuality and who we are and our feelings and emotions can really expand beyond cisgender or like heterosexual normative views or opinions, which I think is extremely important to take into consideration, especially because it is thoughts and feelings about our bodies and relationships and having those conversations with your partners, especially something about like pronouns as we did earlier. And if they're changing their pronouns or adjusting that or just getting used to pronouns that you may not be used to using, such as they, them. And then obviously for LGBTQ plus students, it's the sexual orientation and gender identity, especially with coming to terms with that or developing those identities. And then for a lot of people, it's sexual desires, behaviors, and intentions, kind of what we're actually going to be doing, and the act of sex itself. And then our attitudes, behaviors regarding reproductive health, especially birth control. Birth control is used just more than reproductive health, and that's really important to take into consideration when we're just talking about sexual health. All right, so we're also going to be, like I said about birth control, sexual health is more than just birth control, and it's more than just condoms. So it's going to be, we're going to talk about our physical, emotional, mental, and social well-being in relation to sexuality, because as the sexual health and the peer educators and leaders believe, all of these things that we have tie into one another, and they can really affect your sexual health and your sexual well-being. So it's really important to talk about those different aspects and different dimensions that we have. So these often, it requires the skills, resources, and powers to make informed decisions about our sexuality, which is pretty self-explanatory. And like I said, with those different dimensions, we can use those to make these informed decisions. It also requires a positive and respectful approach to sexuality and relationships, especially when we're talking about the LGBTQ plus community. It's really important to respect others' opinions, beliefs, gender identity, and sexual orientation, whether you're comfortable with that or whether you're familiar with that, or if it's new to you learning about it, asking the right and appropriate questions, and overall just being really understanding and trying to want to learn and not project what you already know or what you already think you know onto someone else, and not like intruding their space in any type of way, and just kind of seeing what you can get out of it and take from it, especially in sexual health and sexuality relationships. So lastly, it includes the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence, which Brianna will be talking about a lot more in depth later, but that's a very important one that is really, really essential to having just a great sexuality and sexual health encounter.
So just to name some not so fun statistics that really show why this presentation is important, there are 20 million new cases of STIs in the United States each year, with young people around ages 15 to 24 making up 50% of all those cases, so 10 million cases. And going off of that, young people, again, this is 13 to 24, make up 21% of new HIV cases each year and this is a statistic from 2017. And then specifically going to queer and sexual minority youth, they are less likely to use hormonal birth control and condoms in comparison to their heterosexual peers, and lesbian and bisexual women are more likely to have ever been pregnant than their heterosexual peers. So you can take a minute and pause this and think of reasons why this might be. And I think it's important to...
No, go ahead.
Oh. I think it's important to see that there are so many different structural reasons why this could be, ranging from minority stress to access to care to access to competent care. Queer youth are more likely to be homeless than their heterosexual peers. Lack of family support. So there's so many different reasons that could lead to these statistics.
I did just want to chime in after Brianna said the statistics that's from 2017, that was from like the Youth Risk Behavior Survey that they've been doing. And the most recent one from 2019 will be coming out soon. So we will be seeing changes in those numbers, but a lot of these statistics are a little bit outdated because the new statistics are coming out soon. So that's also something important to remember, that this is as valid as we have right now, but we will be seeing changes in those numbers within the upcoming years, whether it's for the better or for the worse.
No, thank you for chiming in on that, because I did not know where the statistics were coming from.